Hi, this is Chris Doherty, Vice President for Academic Affairs and Dean of the Faculty at Chestnut Hill College. Happy to be joined by Dr. Nicole Montero. Dr. Montero is a licensed psychologist, professor, published researcher, and author. She earned a PhD in clinical psychology from Howard University with an emphasis on culture and mental health and a minor in neuropsychology, and has received extensive training in trauma, PTSD, global mental health and treatment with survivors of war and torture, long-term and brief psychotherapy, and group therapy through a combination of Harvard Program in Refugee Trauma, Columbia University, and Washington School of Psychiatry. Her work has spanned the globe, figuratively and literally. She has worked with children through adults, providing counseling and psychotherapy, psychological assessment, and clinical supervision. In this capacity, she has worked throughout the US, Grenada, Liberia, Bahrain, and Botswana in settings as diverse as schools, hospitals, juvenile detention facilities, university counseling centers, and community clinics. Living in Ethiopia, she completed her dissertation research. She also served as a mental health team leader in Haiti as part of disaster relief efforts following the country's catastrophic earthquake in 2010, and gained also important experience and insights while living and working in Bahrain during the historic Arab Spring uprisings. Dr. Montero has served as an expert witness and consultant in cases involving child labor, immigration and asylum, disaster relief, and traffic psychology. She's a full-time assistant professor of psychology in the Master's Psychology program at Chestnut Hill College, and also the CEO of her clinical consulting practice, Center for Healing and Development. And you can find out more about her research and work at www.NicoleMonteroPhD.com. Nicole, I'm just delighted that you're joining us for this conversation. I've been doing this with each of the conversations I've been having, but today is March the 30th, March 30th. And I think it's important to mark the time as we have these conversations because things are changing so dynamically. We're coming off a weekend having received some pretty difficult news about projections with regard to the virus's spread, potential fatalities, and it's a pretty somber time, and also, but really appreciate your conversation today with us. Starting specifically with some questions I have for you about disaster mental health. So tell us about your background and expertise in disaster mental health, and what that work entails.
Yeah, no, thank you so much for having me. I'm really excited to kind of be able to share and talk about what's going on in this moment, as you said, which is just so dynamic and changing. And I think that is actually at the heart of sort of what disaster mental health is about. So I teach a class in our master's graduate program, master's clinical and counseling psychology program, that is basically about disaster mental health. And one of the key things that we talk about is just sort of how dynamic and changing on a day-to-day basis the work is as compared to some of the more, the other clinical work that different mental health professionals and psychologists engage in. But I'll just back up a little bit just to tell you about my background. So as you said, I'm a licensed psychologist, trained in clinical psychology. But from the beginning, I've always sort of been interested and engaged in cross-cultural psychology, global mental health, just kind of looking at trends and just, psychology and psychological functioning across the globe in different settings. So I've always just been curious in sort of how what I was learning through my training applied or did not apply in different parts of the world. And so, as you noted, I did my dissertation research in Ethiopia, and I've done some other work throughout Africa and the Middle East. And so inevitably, that kind of gets you into the field of disaster mental health, because a lot of the work within global mental health has some component of responding to crises or, disasters or unexpected situations. And not to mention the fact that, even in the US, there are numerous disasters. When I teach the class, we talk about how even major storms in the city that cause a lot of flooding, because parts of Philadelphia are flood zones. Those can qualify as disasters because, you know, large groups of people are affected by this natural phenomenon. So I just kind of developed over time this interest in it and have had opportunities to actually sort of be in the field as a sort of disaster mental health professional, if we call it that, and have, you know, been able to experience and observe how it's very different from a lot of the work that we're trained traditionally in as clinical psychologists. I was I was volunteering as a mental health team lead in Haiti a few months after the catastrophic earthquake in 2010. And that was where I really was able to get an up close and personal look at sort of the skills that are unique to disaster mental health. Um, Not first and foremost, the idea of developing the skill of being flexible. So a lot of what we do as psychologists is like very planned out and predictable. We have sessions, you know, we meet with people, we know what time we're going to meet. Even when there's an emergency, we kind of know what the procedures are going to be. You know, you could take someone to the hospital, or, you know, everything is kind of, we spend so much of our training sort of being able to understand and predict how we'll respond in different situations. But disasters by definition are just unpredictable. And so much of what's required of anyone working in those kind of, you know, environments is that you have to kind of learn flexibility. And that's one of the things when I teach the disaster mental health class, that's sort of like overemphasized flexibility, and also being able to be okay with taking roles that you hadn't necessarily taken. So a lot of what you might be doing could be practical, helping people to just reorient and get in touch with loved ones, or, you know, if you're in an actual disaster zone, passing out waters, or things that you hadn't necessarily thought of in your training as what, you know, those kind of deep psychological things, but you're really attending to what people need in the moment. And usually what people need at any particular point during or right after a disaster is to get their bearings and to reorient and to try to, you know, kind of get refocused and rebalanced and to be empowered to kind of tap into their own resilience. So a lot of what, you know, disaster mental health professionals do is helping with tangible practical tasks or psychoeducation, explaining to people what they might experience, you know, explaining to them that all of their sort of physical reactions or emotional or psychological reactions are normal. So you're kind of normalizing it for them so they don't feel like something is wrong with them. So yeah, it's kind of like a very different work, more along the lines of like if you think about public health, you're kind of doing primary or secondary interventions. It's not so much that direct one-on-one, I'm going to delve deeply into what your issues are, but rather sort of what can I do more on a broader scale to help as many people as possible.
Thanks. It's really helpful getting given that, how's all this expertise informed your understanding and, just as importantly, your perceptions of the COVID-19 pandemic to date?
Yeah, I mean, it's just been so fascinating and illuminating to kind of watch it up close and personal. And I think, you know, when I teach the class, I always try to point out the various disasters that we're exposed to all the time, whether it's a mass shooting or a natural, um, weather event. Or last summer there was like a power plant near the airport that kind of exploded, and we kind of talked about that in the realm of disaster. But this is, you know, by far the most sort of, you know, one that I think people will grasp and that we're all experiencing. But I was just doing some reading, and the unique nature of a pandemic or epidemic as a disaster is really highlighted in a lot of the literature. So it's considered to be a type of natural disaster, but it has its own unique components. It's like there's this, the mysterious microbe or this invisible contagion that in and of itself just breaks down all of our defenses in terms of, what we do to not accept how vulnerable we are. I think this tears all of this down. Like we really realize we are all so vulnerable just as humans and like being susceptible to this. So epidemics and pandemics, health pandemics, they really kind of touch at the heart of that. And it can be very anxiety provoking, even though we might hear numbers like we don't, you know, the majority of us won't get it. However, there's so much we don't know about this new coronavirus. There's so much information that's coming out, and there's so much nervousness around how it's transmitted, how it's spread, and the things we have to do to protect ourselves are usually the things that we do to get comfort from each other, like connection and being close to loved ones. So one thing, pandemics just really get at that vulnerability. And this one in particular, just even from listening to health professionals, it's just so isolating, even for those who are sick with it, whether they get really sick or mildly sick, they have to isolate. And you have people suffering in isolation and with loneliness and, that disconnection. And so that's kind of been, interesting to watch, as well as sort of all of our reactions, whether we are directly affected or not. With the virus, there's the economic fallout, there's the disruption to our daily life. And so when we think about disasters, we think about like all of the layers of how groups of people who are affected. So there are those who kind of might get the virus, but then there's like people who are losing their businesses or their retirement stocks are like all in the ground. And people, look at the college, we're having to go online, and you have people who maybe never really taught in that way, or students who have had to suddenly leave housing. And, there's so many ripple effects that, basically everyone is being affected, and you can see the different ways that people cope. And we all cope differently, but you can kind of observe, on this, that's what I've kind of observed on this broad scale. Just sort of how we're all affected, the unique nature of a pandemic as a type of disaster, and the different ways that we cope. And also the importance of, when they talk about disasters, one of the most important like sort of things that helps is having transparency in leadership and clear, consistent information. Because once that breaks down, like, that's where there's room for rumors and panic and distrust later on. So if we don't trust in the beginning, then later on, when we really need to trust what leadership is saying, then we don't trust, so and then that has ramifications. So we know part of what we need for this virus to kind of go down is to socially isolate, but everyone has to be on board. And then there's so many psychological and other reasons why people don't necessarily do that. But, that trust and transparency is a huge part of like sort of what plays a part in disasters.
So you've mentioned the general effect of a pandemic, and even that there's a lot of that in the literature. Looking forward, what can we anticipate in terms of the needs of some of the unique populations that are affected by that pandemic? And thinking about for example, healthcare workers. What do we expect for them?
Yeah, I mean, when you think about disaster, you often think about sort of proximity and exposure. It's almost like a dose-related effect. So there's all of us that we can control whether we turn the TV or not on or not. And, and I'm not minimizing the different effects that it has on us. But when you look at frontline workers, first responders, if you might, think of it like that, the level of exposure is just so intense. And so in the moment, they're in fight or flight mode. They're able to kind of focus, zone in, do what they need to do. In some ways, they were trained and built for this, almost like flight attendants. They know what to do in a plane crash because they've just rehearsed it so much, right? But there's a time where once they step away from it, there's they're susceptible to crashing. It's complete exhaustion can set in. I was reading about some of the physicians in China. We know that in all of the countries, the healthcare workers form like a higher percentage of those um, infected. But they were saying like it just looked like some of the doctors just died from exhaustion, or just died from, like maybe if they don't even have the time to just decompress. And so I think that's something we really, really, really have to be careful of, because there's the potential for the physical exhaustion and crash and burn, but also the psychological and mental. There can be survivor's guilt. There can be a sense of I didn't do enough. There can be anger. It could be anger at, just sort of diffuse anger or targeted at leadership or whatever. There can be a sense of loneliness, a sense of vulnerability. Literally, we're hearing about the workers who don't have the protective gear that they need. So, they're literally like, talk about a pandemic getting you in touch with your vulnerability, and even more so for them. So I think that is really one of the most sort of unique, like most vulnerable populations in this. And I think we've got what they need is support, opportunities to support each other, because in some ways we don't know. Those of us who are not there on the front lines, usually when you have first responders, they turn to each other because they can relate to each other's experience. But we have to provide opportunities and encouragement for them to sort of naturally support each other, whether that's through breaks or different ways that you rotate them out, or encouraging them, leadership reminding them that mental health is important. That all of those are, they are just, I can't emphasize enough how much at risk they are. I did a webinar. So another thing, just to back up, that sort of disaster mental health professionals do is just sort of global psychoeducation. So you want to get out there, you want to kind of use social media or other means to just educate people about what's going on, the psychologically and so forth. So I did a webinar earlier today just for the general public about maintaining mental health and wellness during the coronavirus outbreak. And there were several so people had to sign up. And then in the question and answer, there were a few people that said they were healthcare workers. One said she was in New York, and they were kind of saying like, I'm crying right now. Thank you for doing this. And it's just to validate that they need, even if it's 1 hour or 30 minutes, or someone to let them know that what they're experiencing, first of all, explain what's common that they might experience. So I went through some of the physical and emotional and behavioral changes, and to validate it. And they need a break. They need a break. So, just whenever I almost, sometimes cry when I watch what they're going through on TV, because they are sacrificing so much. And I think we've all just got to understand how vulnerable they are. And then also afterwards. So one of the things about a disaster is there are different phases. And so, there's that part where we're like all come together, or the honeymoon phase, we're like working together. But we've really got to, from a planning standpoint, think about months later, years later. That's when, the crash and burn might happen for some people. And that's where disillusionment sets in. So after all of the cameras, after everything gets back to normal, we, need to have different mechanisms in place to help people, because that's when they might be more at risk for substance, unhealthy coping, drinking more, whatever it is that they do to cope that might, not be as healthy.
How about thinking about those who are afflicted and their families? You referred to the loneliness and the isolation that's incumbent with this particular pandemic. What some thoughts there in terms of your expertise and experience?
Yeah, I mean, that's sort of also one of the main groups that we're worried about, because there's and no one really knows with this virus, right? Even if we look a lot at the death rate and, thank God if you live, but then there's so many unknowns about whether there's lasting damage to your lungs. And, it's almost like a gunshot victim. They live, but that's not the end of the story, right? Like, what kind of injuries are there? And so I think, but, during this part where we're still sort of people are getting diagnosed and so forth, I think that those people are definitely at risk, and their family, for all kinds of psychological breakdowns if there isn't sufficient support. And so the social support is so important, and that could be as much as, like, I saw some of the people who were hospitalized who were well enough, communicating with people on FaceTime and social media and things like that, just trying to have that connection because they recognized how isolating it was. I saw a few interviews where the people, those hospitalized said even when healthcare professionals came in, they were dressed kind of like in the full protective gear. They never had skin to skin touch. They couldn't really see them because they had all these things on their face. So it just reinforced, even if the physical symptoms were not so severe, like they might not have been on ventilators or anything, but it just reinforced how lonely and scary it was. And I think what I've also been seeing is so many people becoming anxious about, do they have it? Because it's like, oh my God, my throat is tickling. Or, now we have seasonal allergies. So a lot of people are trying to determine, is it allergies or, any little thing, your spouse coughs and you're like, are you okay? So it's creating that anxiety, and then the symptoms of not having difficulty breathing. And I think I've heard where some of the people who are diagnosed, they're anxious, anticipating if that's going to happen to them.
Any other comments just with regard to, moving out to that general population of individuals who might not be directly affected by it, and what that's doing to us?
Yeah, I mean, I think it's changing us. It's changing us, and it has the thing about any disaster is there's post-traumatic growth. There's opportunity for growth and the coming together, all of the altruism that you see. But there's also, again, we are all in some ways in fight or flight mode, which is survival mode. So if we start to feel like we can't get our basic needs, like if the economic fallout goes too long, or people, we saw people kind of fighting over toilet paper, but and people joked about it. But, if there's a sense at any point for the general population that there's no end in sight, or there's a sense of like, I'm not going to survive this and whatever that means for that person, it could, lead to panic. And I don't mean like everyone running in the street, but it could even be internal panic. And so that's why I think the more people get out there with accurate information, reinforcing wellness and how you take care of your well-being, encouraging people, even with the shelter in place, if you go out and just sniff some fresh air or take a walk, or, I think for the general population, it's just kind of has to be constant messages of how to maintain your wellness, so that kind of even helps to get you out of that strictly survival mode where, it's more likely that people would panic. But yeah, people are going through a lot. And I think one thing I have recognized is that a lot of people have difficulty seeing that we all cope in different ways. And so someone who might seem dismissive, that could be the way they cope. And for someone who's calmer, when they see someone going and buying up everything, they kind of are like, oh, that person's crazy, right? But we all kind of just take it in and cope in different ways. And so another kind of message that I've been hearing and even trying to reinforce is just to validate those different ways of coping. And to maybe, if you see something or someone is not coping so in such a healthy way, to gently steer them, not to kind of like chastise them, because this is a time where we all need kind of more compassion for how we deal with others. But yeah, I've heard people just talking about how it feels to be so disconnected from people. And it makes sense because we're wired for connection, right? So it's really taking a toll on people. So the more that we can kind of reinforce ways of connecting, even if it's not so physical, we should do that.
Great advice. When you teach this topic, disaster mental health, what do you share with your students?
Well, it's interesting. So a lot of times students aren't quite sure, like they're not, unless they really had a passion for this when they signed up for the class, they're not like, okay, I'm not quite sure what this is. I don't know if it's relevant. I think after this, everyone will see that it's relevant. But I think that people I try to emphasize sort of how the skills that we have as mental health professionals, as counselors, as psychologists are really, really helpful. Some of those skills could be demonstrating self-care. And in order to do that, what does that mean? We have to take care of ourselves. As it's like a doctor, you can't be telling your patients not to smoke and you come into the room with a cigarette, it's kind of the same thing. But another thing that so sort of encouraging that their clinical skills are certainly applicable to these disaster situations, their ability to reassure people, to validate people, to be able to observe. And there's some people who are going to be struggling more. So there's like the 85% that have the common reactions. And then you might have people, because of their history or things that they've been through, they might really, really be struggling. And we've got to, do some different things for them. But I think another thing that is key is highlighting how the factors that are in society, race, class, economic status, vulnerable populations, how these things are going to be highlighted and exacerbated through the crisis. And we're, in a disaster, and we're hearing that, right? We're hearing about, when we say essential workers, a lot of these are hourly employees, but we're asking them to be at risk. Or hearing about, schools being let out for the rest of the school year. And there are many people that don't have childcare, don't have maybe multiple devices to plug their kids into online lessons or print out everything. It's just highlighting so many of the inequalities in society. And that's something that we always try to highlight. There's usually a movie I show them in the beginning of class about Hurricane Katrina. And it's a firsthand documentary of a family that went through it, and sort of they were a poor Black family, and it just highlights so much of sort of what went wrong down there after Katrina. But I think we can kind of see that now. It's not even just that anyone in particular is doing anything wrong, but it just shows you that people are affected differently depending on their social status in society. And those that are more privileged in more areas, not to say it doesn't affect them, or us, but it definitely is different. It's definitely different. I saw an article, a man in India was saying, more of us are going to die from hunger than from coronavirus as a result of the lockdown, because so many people survive hand to mouth. Whatever they make that day, that's what they're able to eat. And so with the markets closing and all of that, it's really putting a lot of people, it shows the precarious station of a lot of people. So that's like one of the main things that I, try to have the class think about and be aware of, and and it also informs our interventions. So we don't want to bring our privilege and tell people to do things that's just not, oh, go get, go buy something, or something that we might do. But if people don't have the money, or if they're struggling, we tell people to do social distancing, but they only have public transportation. We've got to be mindful of that.
So, given your expertise in trauma, anything else you think that tells us about what we might anticipate or expect in terms of all the events we're witnessing right now?
Yeah, that's a good question. I was reading an article that said the next epidemic we need to be prepared for is a mental health epidemic, or and not to sound dire, I think in some ways we have to be optimistic but also realistic. And I think you know people have been struggling. There's a lot of talk about the deaths of increase in deaths of despair. So people who and they saw for the first time, like middle age or middle class white males had a lower life expectancy, like it was going down instead of going up. And they were talking about it in terms of deaths of despair, and how people now, if there's a sense of hopelessness in society because of social inequality, or people feeling like they can't get ahead, that's where you see drug addiction, that's where you see suicides, that's where you see sort of passive suicides, kind of people living recklessly, maybe not deliberately killing themselves. And so we had already been seeing a rise in that. And just here in the Philadelphia area with the opioid crisis, that is just sort of one big phenomenon of despair, right? And hopelessness. And so I think we've got to watch out for how, not next month, not even next year, but after that, sort of how people are still going to be grappling with this, struggling with this, trying to recover. How is a recession, going to affect people? I just read that someone in Germany, it wasn't the vice chancellor, I forgot, someone in the German, like high in the government, killed himself because of this happened, I think 2 days ago, because of the economic fallout of the coronavirus in Europe. And so, I think, there's some high profile examples, but I think there's going to be a lot that is not, you know, publicized like that, but we'll probably see in the trends. And so I think, that's even more reason to keep thinking about how to make sure that people have mental health services, and that we have people trained to see and notice, trained in trauma, people trained in sort of the aftermath of disasters, so that they can sort of observe when people are starting to have their downfall. And the thing is, I would just caution, we won't see it for a while. So again, now people, I think we're kind of getting out of the denial. We're seeing that this is real. But we still, I don't think it's completely hit us as a society yet. And I think we've got to plan ahead for how people are going to, again, maybe crash and burn after all of this is over, and be more vulnerable to those sort of, that hopelessness, the despair, things that lead to drug use and unhealthy lifestyle and things like that.
So grateful for
Mm.
kind of everything you shared in the context of what we're experiencing. Before we wrap up the conversation, I've been asking each of the faculty I've been speaking with just about their experience of this in the context of the work that we do at the college and teaching. And I know, Nicole, in your case in particular, you've been on a whirlwind rethinking of sort of a high time on task course that you have been redesigning
Yeah.
intensively over the past week. So we appreciate that. And so what about your teaching right now? How has it changed in terms of both the switch to an online environment, but then also just in terms of teaching in this moment?
Yeah, I think I've learned to focus less on information and more on connection. And not to say that we're not here to give, continue to give, the quality. But I think right now quality is probably defined a little differently. And I think it's about connecting. The students are, you know, some of our students were at the end of getting all of their internship hours, and now the internship is shut down. So, you know, people are worried, and I think they need the consistency and reassurance from us. And, you know, their brains are not even necessarily able to take in large chunks. So I'm kind of just trying to reconfigure sort of less talking, more connecting, more presence with them. However, that can go, you know, digitally. It's a
Yeah.
little bit difficult.
Yeah, I've been thinking the same thing. I mean, I'm teaching a class now too, and just
Mm.
taking time when we conference, which is not, you know, most of the time is spent now. I've moved up the course over to being primarily asynchronous, but how much of that time is important just to be in the moment together and to solidify and help identify what this all means. And my hope for everyone, all of us who are learning through this moment, is that um, that what we learn now will have such salience because we'll be
Mhm.
connected to everything we're experiencing. Um,
Yes.
what should we be teaching Chestnut Hill College students about this moment? What's, from your perspective, what's important for them to know?
Wow, that's a good question. I think it's important for them to know that they they're in the middle of history. You know, they're at an age where you read about what your parents and grandparents did, and but now you're the ones that they're going to be reading about
Mm.
generations from now, and to just encourage them that they're going to be okay, that they have what it takes to get through this, and that we, you know, I think we need to be teaching them resilience, you know, more than anything, and to have them really, you know, to reassure them that they do have that resilience. That's something I believe in. That's something that's a tenet of sort of disaster mental health, just having people tap into what they naturally have. So just, you know, and I think the college is doing a great job just with consistent communication and being transparent and clear and trying so many different methods to meet their needs and see who's falling through the cracks. And so I think if we I think they just need to know they are in the middle of history. They will be that great generation that we hear about. And I think we just have to support them in that.
Dr. Nicole Montero, thank you so much for, in the midst of everything that you're doing right now, for taking the time to share your perspectives in this conversation. I'm grateful, and I'm certain that everyone who will have a chance to share this information will be as well. I appreciate your time and wish you well, and give you thanks for all you're doing to support the college, to support our students at this time.
Thank you so much. Thanks for inviting me.
Yeah, take care, Nicole. Thank you again.
All right, take care.